Good afternoon, everyone. Thank you for being here. I'm Dr. Larry Antonucci, President and CEO of Lee Health. When the Delta surge peaked and subsided, we thought that maybe that was the worst of it as we dealt with this pandemic. But now we're being faced with another variant, the Omicron variant, and it's causing significant challenges in our community. And so I wanted to talk a little bit about that. So today we have 284 patients in the hospital, in our Lee Health hospitals with COVID, and 29 of those are in the ICU and 12 are on ventilators. In the past 2 weeks, the number of patients hospitalized has increased 380%. And our children are being affected by Omicron also. Today we have 9 children in our hospital with COVID. 4 of them are in the ICU. And the range in age of these children is 22 days to 17 years. While the Omicron variant seems to be less severe, it is still making patients sick and making patients sick enough to be in the hospital, to be in the ICU, and to be on ventilators. So at this time, I'd like to introduce Armando Yechu. Armando has responsibility over all of our inpatient care, all of our hospitals, both adults and children. Armando?
So thank you, Larry, and thank you all for being here today. Our hospitals are again nearing capacity. For those of you that I had the opportunity to speak with months ago, the strain on our staff is incredible. We are at 93% of our staff capacity today, with projections that over the next couple of weeks, we will get close to being at full capacity. Due to the high census and due to the high number of employees currently out either with COVID or on quarantine, everyone has experienced longer than usual waits. We've had to make changes to the way we provide care. And as of many of you may know, we stopped doing non-emergent elective procedures that require an overnight stay last week. We anticipate that's going to continue for the next 3 weeks or so. We also understand that all of the patients that are seeking emergency care in our emergency departments are waiting longer than usual. I would remind you that the entire country is short-staffed. Everywhere you go, people are facing staffing challenges, and healthcare has had no exception. We are in what we would consider our normal peak season with our seasonal residents coming into town. Our hospitals were already experiencing high volumes in the ER and high volumes of patients being admitted, and that was prior to this current wave of the pandemic. We urge our community to not come to the ER to seek testing for COVID. There are alternate sites for testing that can be found on our website at leehealth.org. If you are having respiratory symptoms of COVID, or any medical condition that you deem to be emergent, please call 911. Please come to one of our ERs. We are ready to care for you. For those of you that have a patient under the age of 21, we would encourage you to seek emergency care at the Golisano Children's Hospital. There is a fully equipped, fully staffed ER ready to care for your children. Our Lee Convenient Cares are also facing very long wait times and an incredible increase in patient demand. In order to help ease the burden for our community and for our ERs and convenient care locations, we have once again made telehealth visits free to the community. Those telehealth visits, which are usually $49, can be accessed through leehealth.org, and you will be able to speak to a physician or provider online from the convenience of your home with minimal wait. We encourage you to try that avenue unless you have a true emergency that requires a visit to our convenient care location or to one of our emergency departments. This wave is forecasted to peak over the next 2 to 3 weeks. We do not anticipate that things will get better. We anticipate that they will get worse. So we ask you as a community, wear a mask, social distance, wash your hands. If you don't do it for yourself and your loved ones, do it for our healthcare providers who have been dealing with surge after surge for close to 2 years. Thank you all for being here. Thank you for supporting us, and we look forward to speaking to you. Larry.
Thanks, Armando. As Armando said, we're asking the community to do everything it can to try to slow down the spread of this virus. We know that the best protection is through vaccination. We know that if you're vaccinated and boosted, your likelihood of winding up here is a lot lower. In addition, your symptoms are likely to be mild if you've been fully vaccinated and boosted. So we're asking everyone to please, if you've not been vaccinated yet and you are eligible, or if you're eligible for a booster, to please do so. The vaccines are available throughout our community. They're available at our Lee Health sites and also many other offices, pharmacies around the community. Again, you can visit leehealth.org to learn more about where vaccines are available. We know breakthrough cases are occurring. People who have been vaccinated are getting COVID, are getting the Omicron variant. But as I mentioned earlier, the symptoms tend to be much less severe, and most folks have symptoms of a cold for a few days and get better. So we know that vaccination helps protect you against the serious consequences of COVID. In our community, only about 35% of patients have received their boosters. So there's a lot of opportunity out there for more patients to get out there, get boosted, and prevent a hospitalization. As Armando said, please also remember to do the simple things we've been talking about for 2 years. Social distancing, hand washing, wearing a mask when you're in public around people. All those things will help slow the spread of this virus. So again, thank you all for being here. We'll be happy to answer any questions